Gastroenteritis, commonly known as the stomach flu, is an inflammation of the stomach and intestines, usually caused by infection with viruses, bacteria, or parasites. It leads to symptoms such as diarrhea, vomiting, abdominal cramps, and sometimes fever. Gastroenteritis is highly contagious and can affect individuals of all ages. Causes: viral infections. Most common cause: notavirus, common in adults and known for causing outbreaks in crowded settings like cruise ships, schools, and hospitals. Rotavirus, a major cause of gastroenteritis in young children, though it can affect adults as well. Adenovirus and astrovirus can also cause gastroenteritis, especially in children. Bacterial infections: Salmonella, often spread through undercooked poultry or contaminated eggs. Escherichia coli, E. coli, found in contaminated food or water, especially raw vegetables or undercooked meat. Campylobacter, usually linked to undercooked poultry or unpasteurized milk. Shigella, spread through contaminated water and poor hygiene. Clostridium difficile, the bacteria that can cause severe gastroenteritis, particularly after antibiotic use. Parasitic infections: Giardia lamblia and Cryptosporidium, often found in contaminated water sources and can lead to prolonged gastrointestinal symptoms. Toxins or chemicals: consuming food or water contaminated with harmful toxins or chemicals can trigger gastroenteritis. Transmission: gastroenteritis spreads through contaminated food or water. Ingesting food or water contaminated with viruses, bacteria, or parasites. Person-to-person contact: touching surfaces contaminated with infectious agents and then touching your mouth or food. Close contact with infected people. Direct contact with an infected person or sharing food and utensils. Symptoms of gastroenteritis typically appear within 1 to 3 days after exposure and can range from mild to severe. They include diarrhea. Frequent, watery stools are the hallmark of gastroenteritis. Nausea and vomiting often accompanies diarrhea and can lead to dehydration if severe. Abdominal cramps and pain. The inflammation can cause cramping or discomfort in the stomach and intestines. Fever. A mild fever may occur, especially with viral or bacterial infections. Fatigue and weakness. Loss of fluids and nutrients can lead to tiredness and weakness. Dehydration. Severe vomiting and diarrhea can lead to dehydration, especially in children and the elderly. Signs of dehydration include dry mouth, decreased urination, dizziness, and sunken eyes. Diagnosis: gastroenteritis is often diagnosed based on symptoms and medical history. In severe or prolonged cases, additional tests may be done. Stool sample. A stool test can help identify the cause of the infection, especially if it's bacterial or parasitic. Blood tests. These may be ordered if dehydration or more serious illness is suspected. Treatment. The treatment for gastroenteritis focuses on relieving symptoms and preventing dehydration. Most cases resolve on their own within a few days without the need for medical treatment. Rehydration. Oral rehydration solution stores rehydration with a solution containing water, salts, and sugars is essential, particularly in children. Stores helps replenish fluids and electrolytes lost through diarrhea and vomiting. Hydration. Drink plenty of clear fluids like water, broth, and diluted fruit juice. Avoid sugary drinks or caffeine, as they can worsen diarrhea. Diet. Bran diet, consisting of bananas, rice, applesauce, and toast. This bland diet is often recommended to ease stomach upset. Small, frequent meals. Eating small amounts of easily digestible foods can help reduce nausea and maintain energy. Medications. Antidiarrheals. Over-the-counter medications like loperamide Imodium can be used for symptom relief in adults but should not be used in children or those with certain bacterial infections. Antibiotics. Only used in cases of bacterial gastroenteritis, e.g., from Salmonella or Shigella, and when prescribed by a doctor. Antiemetics. Medications like ondansetron may be used to reduce nausea and vomiting. Rest. Getting plenty of rest is important for recovery, especially when feeling weak or fatigued. Complications. Gastroenteritis can lead to complications, particularly in young children, the elderly, and those with weakened immune systems. Dehydration. The most common complication, which can lead to serious health issues if not treated, such as kidney failure or shock. Electrolyte imbalance. Loss of salts and minerals from vomiting and diarrhea can lead to imbalances, causing weakness, confusion, or irregular heartbeats. Prolonged illness. Some infections, especially parasitic ones, can lead to long-lasting symptoms or more serious complications, such as chronic diarrhea or malnutrition. Prevention. Preventing gastroenteritis involves practicing good hygiene and food safety. Hand washing. Wash hands thoroughly with soap and water, especially after using the bathroom, changing diapers, or before preparing food. Food safety. Cook food thoroughly, especially meat and eggs, and avoid raw or undercooked items. Wash fruits and vegetables before eating, and ensure food is properly refrigerated. Water safety. Drink only clean, safe water, and avoid drinking untreated water from lakes or rivers. Use bottled water in areas with poor sanitation to ward off outbreaks of waterborne illnesses. Vaccination. Rotavirus vaccine, administered to infants. This vaccine can prevent the most common cause of severe gastroenteritis in young children. Conclusion. Gastroenteritis is a common illness that can be caused by various infectious agents. While it often resolves on its own with supportive care, it can lead to dehydration and other complications if not managed properly. Preventive measures like proper hygiene, safe food handling, and vaccinations are essential to reduce the risk of infection.